Okay, the meeting is being recorded. Is it 1 o'clock? Okay, so I'm going to begin. My name is Ann Friedman. I am the PSC Retiree Chapter Chair, and I welcome everybody to this special June 5th, 2023 chapter meeting on the healthcare crisis. Particular welcome to those of you who may not be members of the chapter. We did send out invitations to hundreds of non-members, hoping that you would join us for the program and then also join up and become a member of the chapter. And Diane Mena, our vice chair, will say more about that later, and we'll be putting the join up links in the chat. And of course, our chapter and our union derive its strength from its base, its foundation. And the foundation, of course, is us, the members. And we are a pretty hefty chapter. We have 3,000 members. We are the second largest chapter in the union, but that's in a union of 30,000 members. So we are very fortunate to have at our backs the leadership of the entire union and members of the entire union, and supporting us in our particular issues. Many issues we have in common with other union members, but certain ones are very, very particular to us in certain ways, as you'll hear today. There's much to say about the structure and work of the chapter, but the most important thing is the work that we've done for over 2 years on fighting to maintain traditional Medicare and our traditional senior care, and to struggle against the privatization and diminution of our benefits. The PSC has stood strong and proud in resisting these efforts, and has offered visionary and constructive solutions to problems that we face. And to talk about that and put our struggle in context, I am very proud to introduce the president of our PSC, James Davis. James, are you here?
I am here, Anne. Hi, can everyone hear me?
Welcome, James.
Thank you for inviting me. It's really good to see everyone. I think you guys run maybe the largest meetings of any chapter in this union. So first of all, thank you, Anne and Bonnie and Diane, for inviting me to attend and to open up the meeting today. As Anne began by pointing out, the retiree chapter of the PSC is among the mightiest of our chapters in so many ways. So if you're not already a member of the chapter, I hope you will consider joining. I was asked to just speak briefly about some of the context in which the retiree healthcare controversy has been playing out. I'm going to be brief because I looked at the agenda, and it's an ambitious agenda befitting the chapter. And you have a number of people to hear from. I wanted to begin with some big picture remarks and hopefully seed the ground for additional conversation as the meeting goes on. Let me just acknowledge that there are a lot of really immediate questions that PSC retirees have and real concerns. And I think that our hope today is to begin to address some of those concerns. We are in the middle now of the window period where retirees are being asked whether they want to enroll in the Medicare Advantage Aetna plan, whether they want to opt out. What is the difference between opting out and waiving city coverage altogether? these are really important, non-trivial questions that are right in front of everyone. We have currently before the comptroller's office the question of whether to approve this contract that was referred to his office for review and approval. You've probably seen in the news that there is also very recently a lawsuit from the same group that brought the prior lawsuit, a challenge to the legality of the city's agreement with the Aetna plan. And some of you also probably know that there's ongoing actions in the streets and at City Hall, including I think one this Thursday that the Public Service Retirees Group is bringing out. And so I just say all that to acknowledge that there are immediate burning questions and concerns, and a lot of the questions that I know people have at this meeting are specific to yourselves, and they don't have to do with the big political picture. But that said, I do want to put some of this in context and to say that the union continues to struggle around access to free, high quality healthcare for all of our members and our in-service active members and retirees. We believe that the comptroller is likely to go ahead and approve this contract with Aetna. But what I also want to do is to try to push the comptroller to use that, if he's going to approve the contract, to use that as an opportunity to talk about what's at stake in shifting, 250,000 retirees onto a private plan, and what kind of accountability everyone in elected city government at the moment is going to exercise around that, and what kind of accountability they're going to expect from the company that's running the plan. Part of that, and I want to take a step back, part of that is the fact that at this point, and many of you know this better than anyone, the country recently crossed over the threshold to the point where more than half of the retirees in the country are now in privately administered Medicare Advantage plans. That's astounding. And this is happening at a moment where the deficiencies and inadequacies of Medicare Advantage plans writ large are the subject of increasing media attention and increasing scrutiny from elected officials. And I think that's a good thing. I think it makes it's a good thing that more and more retirees are in those plans, but that there's more scrutiny and attention onto the plans themselves. The risks that come along with those plans, I think, is becoming clearer. And the criticism that comes along with that, I think it's important that that's happening even regardless of what happens with the lawsuit that's been filed. I think it's really important that attention from lawmakers is happening, and the attention from the media is also happening. So we continue to have some really sharp goals we've had all along. Ultimately, we want to see reinstated a city-sponsored premium-free Medigap plan, a supplemental plan that will be combined with traditional Medicare. We haven't given up on that, despite the fact that this contract appears to be moving forward. We want to make sure that we preserve high quality, again, free healthcare for our in-service members as well. And I really underscore high quality here because, as some of you know, there are bids out now for the comprehensive benefits plan for active in-service members as well. So the GHI emblem plan that in-service members have right now, the city wants to try to find a way to save 10% of costs. Is that possible? I'm not sure. Is it possible without compromising the quality or access that our members currently have? I'm skeptical. We need to make sure we're positioned to fight on that front as needed. And then, last, and this is, I just want to always bring us back to the union's broadest goal, which continues to be to fight for single payer healthcare at the state and national level. And I realize with the current composition of, of Congress, it's unlikely to happen in the moment, but we need to continue to push on that front as our ultimate goal. We in the union, we are currently thinking about sort of two phases in front of us, and really are going to need the involvement of all of you and really all PSC members, not just retirees on this, because we're going to need to push in the short term. We're going to need to push the Office of Labor Relations at the city level and Aetna, again, if the contract goes through, and I don't want to presume anything, but it appears as if it will, to push them around protecting the most vulnerable among our retirees. So that includes people who currently have, treatments scheduled and ongoing, or have surgeries scheduled, and they need to know what the continuity of care looks like. And we just need to accelerate the continuity of care plan that Aetna and OLR have in place. Some of you know, and I promise I'll wrap up in a second, some of you know that Aetna committed to reporting some pretty standard reporting obligations when, under this contract, but it actually needs to be even more robust. And we feel like we need more transparency than this contract commits them to in terms of reporting, precisely so that we can see what the progress of the plan is, what the costs actually are, and what the experience of retirees who are in it, what their experience is like. And if Aetna's only obligation is to report that in a narrow sense, that won't ever come out to the unions, so that and the broader public. So we want to push Aetna on its reporting obligations, and frankly, we need to push the city to expand its own capacity to monitor and to manage retiree health benefits more broadly. There's an incredibly thin staff, and some of you may have had experience with that already. We know that if we are going to, I was going to say reinstate, but it would really require at this point a new supplemental Medicare plan. We won't get senior care back if this goes forward, but whatever we can recover that would be the equivalent of a senior care plan. We want to try to create the political basis, the terrain to fight for that. That may include legislation. It certainly would include the support of other labor unions besides the PSC. So one of the things that I'm committed to doing over the summer is to resuming the conversations that we had as a union in the spring with other labor leaders to talk about what we can agree on in, if the contract does go forward, the need to reinstate a supplemental Medicare plan. So we are going to be calling on the retiree chapter leadership and all of you. So many of you also know, and I'll just close with this plug, we have a social safety net working group, which has a broader portfolio of issues than just healthcare, but healthcare is such a critical one right now. And the PSC is going to, be seeking to provide additional support to the social safety net group by having a dedicated organizer from the PSC staff to work closely with the social safety net working group going forward through the summer and the rest of this year. So let me just wrap there. Again, thank you for the time at the start of the meeting. And I know people really want to get in to some of the specific questions and concerns. So I'll just stop there. Thanks again, Anne and colleagues.
Thank you very much, James. Debbie, I think you're next. Debbie Bell.
There we go. Okay.
Hi, Debbie.
Hi. Hello, everyone. Particularly for those of you who may be new to these meetings, I draw your attention to the retiree chapter website, where we have worked for months to post the best, most detailed information and most accurate information we can collect. And I am not going to go through point by point what's on that website, because at this point it's about 5 typed pages worth of information. But I want to let you know, first of all, that there is a recently updated version that was put up over the weekend. Thank you, Bill Friedheim and Bonnie Nelson, for your support in this work. And that we will continue to update it and put the dates on the page, so you know you can say, oh, there must be something new here. And I want to start by differentiating, as James did, between opting out and waiving, for those of you who may not have been in prior meetings. Opting out through Aetna simply means that you will be transferred to the HIP VIP managed care, Medicare Advantage HMO, sorry. It does not mean you're saying, I don't want Aetna. It only means I don't want Aetna, but I will take HIP this. In order to stay in traditional Medicare, you must waive city coverage by filling out a form that is on that's both within the FAQs, basic information FAQs on the retiree website, but it's also on the OLR website. So it's very different from the last time we all went through this. Now, new information. First of all, as Donna Costa from the Welfare Fund will explain later in the meeting, good news, the Welfare Fund trustees voted that all those retirees currently eligible for Welfare Fund benefits will continue to be eligible for Welfare Fund benefits, even if they waive city coverage. And that includes spouses and dependents, and it includes spouses and dependents who are both Medicare eligible themselves, but also those who are under 65. So everyone who is currently covered will continue to be covered. We also got some additional information recently by following up on your questions and asking the Office of Labor Relations that at the end of the period during which you can opt out or waive city coverage, which is May 1st through June 30th, several things will happen, but those who waive city coverage will receive a mailing from the Office of Labor Relations on July 1st, confirming receipt of their waiver form. Those of you who choose to have chosen to opt out are being sent on a weekly basis letters from the Office of Labor Relations saying you have opted out. Do you understand this means that if you're in the New York City metro area, you will be transferred to HIP-VIP, or do you think you were doing something else? So those letters are going out weekly. I will remind you that if for some reason you have not been receiving mail from the Office of Labor Relations over the past few months or from Aetna, please go on the OLR website and find the address change form. Put the correct address so you will get these mailings. There are several important questions that have come up in recent meetings that are addressed in the FAQs. And I also want to draw your attention to 2 articles that we have posted on the website for those of you who are contemplating waiving city coverage and staying with traditional Medicare, which is your right. Everybody is always and forever, once they hit 65, covered by traditional Medicare. But an article about understanding Medigap plans, which includes some discussion about the questions of pre-existing conditions and cost, and includes a lot of links to what we see as the best publications to help you understand what the Medigap plans are about and how to select a new one, if that's the road you go down. Also, there is an article which was an expanded version. Oh, there it goes. It's up on the chat, the link to the Understanding Medigap. Also, there's an article by Bonnie Nelson that appeared in the retiree newsletter about estimating the cost of waiving city coverage, because there is a cost. You will no longer be reimbursed for Medicare Part B or IRMA. You will have to pay for your Medigap coverage, et cetera. So that article is also separately shown on the website, and there are links to it in both the FAQs and other places. Now, a couple of important questions are addressed in the FAQs because I'm seeing them begin to pop up in the chat. What will happen to current retirees who turn 65 after 9/1/23? Basically, they will be automatically enrolled in Aetna, but there's more information in the FAQs. What happens to those over 65 who are still working and retire after August 2023? That's also covered in the FAQs. You still fill out all the pile of forms that CUNY gives you. If you wish to waive, in both cases, if you wish to waive city coverage and not go into the Medicare Advantage plan, that is, those of you who are retiring in August, or those of you who already retired but turned 65, you have to fill out the usual enrollment form that the Office of Labor Relations has on its website. And there is a little hidden box, I mean, you just have to look hard to find it, saying you want to waive city coverage. The special form only applies for this 2-month period. There's also information about what to do if you have received no information at all from OLR or from Aetna in the past several months. There's also information about what to do if your provider accepts Medicare, but does not want to join the Aetna network. And there are a number of those around, particularly in the New York City area, who are not in network. Those are addressed in the FAQ, so I'm not going to go into enormous detail on them. We also, in the FAQs, have a large number of points about the implications of waiving city coverage. Every retiree and their spouse is different in terms of your healthcare needs and in terms of the providers you see on a regular basis and want to continue seeing. So it's really worth your while to read this information, to link to the additional information that's listed in the FAQs, and try to figure out what works best for you. There are also a series of questions and answers about transitioning between Medicare Advantage and traditional Medicare plus Medigap, or vice versa. What to do and when to do it. The bottom line is you never lose your eligibility for traditional Medicare. Also, you can disenroll from Medicare Advantage at any time during the year. The issue becomes when you can purchase a Medigap plan, which is not at any time during the year necessarily, to cover the medical costs that traditional Medicare now pays, or that traditional Medicare doesn't. Senior care covers the difference between the 80% of outpatient costs and 100%. So that 20% is now covered by senior care. That's what a Medigap plan would cover. Traditional Medicare covers most inpatient costs, but there is an inpatient deductible. Senior care currently covers that, and a Medigap plan can cover that. There is a large range of Medigap plans among which you can choose, and they cover different things and therefore cost different amounts per month. The other important thing is to understand that the rules that govern those Medigap plans vary from state to state. 70% of PSC retirees live in New York State, Connecticut, or Massachusetts. Which states have rules that are quite flexible compared to all the other states? They, for example, ensure that you can purchase a Medigap plan even if you have a pre-existing condition. Other states, that guarantee is not so secure. You sometimes have to wait, you sometimes get charged more, and in some cases can't purchase one at all. To enroll enrolling in Medicare Advantage can only happen So this is, again, you can disenroll anytime, but to enroll in Medicare Advantage, you can only do that during the open enrollment period that Medicare in New York City set at between October 15th and December 7th each year, or during the special Medicare Advantage enrollment period between January 1st and March 31st. So in other words, you can disenroll from Medicare Advantage anytime. You can only enroll in Medicare Advantage during certain set periods. I realize this is quite confusing, all this information, but it's covered in the FAQs that you can read at your own leisure. I suggest you read them several times. I also suggest you keep the evidence of coverage booklet, which is the fact booklet that Aetna sent out in April. That booklet, which is very poorly written by lawyers, no doubt, but contains all the rules by which this Aetna plan is regulated, so that you can find information. I tried to include in the answers in the FAQs some references for you on certain knotty issues. There are issues that have come up in these meetings that we still don't have definitive answers for. We are trying to get those out of the city and out of Aetna. We will continue to do that. That means that these FAQs will continue to be updated. And thank you very much.
Thank you so much, Debbie. I printed out the FAQs this morning just to have them in hard copy. It's 7 pages long, and there are 22 questions answered, many of them with multiple parts, and a tremendous amount of work has gone into this and will continue to go into this. So please utilize it. Obviously, there are links which you have to use the online version, but please use this as a resource. Okay, next is Bonnie Nelson.
Hi, everyone. I'm going to try and share my screen so you can see this nice chart that I made. Let's see. Okay, hopefully you can all see that.
Good.
Is that good?
Yes, very
All right.
good.
After I wrote the article in the May issue of Turning the Page about the cost to you of waiving New York City health insurance, we got a lot of inquiries about how do I pick a Medigap plan? How do I figure out what it's going to cost for a Medigap plan? What's the difference between the Medigap plans? So I try to look at the most common plans that people choose and figure out how you can decide how you want to make a decision. And I came up with this chart. Now, the most common plan, I think, nationwide for a Medigap plan is Plan F. And that's because it covers everything. You don't have to worry about, any deductibles. You don't have to worry about copays. You don't have to worry about anything, but they're expensive. There are other plans that are also very popular. Plan F is being phased out in favor of Plan G. Plan G is very much like our current senior care, in that once you pay the deductible, everything is covered, and the deductible is fairly low. It's just the Medicare Part B deductible, which is $226. Another plan that is very popular is Plan N, which is very much like senior care with the copays, which we had for a few months. But the copays in Plan N are higher than we had in senior care, but otherwise it's very similar. So I picked, and then there's the high deductible Plan G, which people often don't think about, but which I find very alluring if I was considering buying a plan. So this chart just shows what the premiums might be. And these are the premiums, as an example, for somebody who's living in New York City. So it shows what the premiums might be. And by the way, it's the cheapest of all the plans. If you go on the compare plans on the Medicare page, on the Medicare site, they have a very easy way you can compare the cost of different plans, and I will put that link up after I'm finished. You can see that for each plan, there are a range of costs. I don't know why anybody would choose anything other than the cheapest plan, but some people do. But you certainly can, check and see what the cost is in your area. So the rates on this chart are for somebody living in New York City. It's the cheapest rate for each plan. I think for 3 of them, the cheapest rate was the AARP United Healthcare plan. For 1 of them, the cheapest rate was Emblem. So they all thought to follow the same rules, though. Medicare sets the rules for each plan. New York State uses community rating, so there's no difference in the price based on your age or your health status. But the cost does vary, even in New York, depending on where you live. In other states, your cost might vary depending on your age and health status. Now, it's easy to see which is the most expensive plan. That's Plan F. So the maximum possible cost that you might have to pay for Plan F is $3,960 a year if you're living in New York City. That's just the cost of the premium times 12. So you can see the annual cost of the premium is $3,960 for Plan F. And that's the most you'll ever pay with that plan. The minimum cost, if you never use healthcare, if you never go to the doctor, what's the minimum cost just to cover, just to make sure you're insured? The minimum cost, the lowest, is with a high deductible Plan G. You'd be paying $68 a month, and your annual cost for your premiums is only $816. But what's the maximum possible cost? Well, for that plan, it's $3,742, because the maximum possible cost for the high deductible Plan G would be your premiums plus the deductible that you have to pay. And it's a very high deductible for Plan G. The deductible is $2,700 plus the $226 Part B deductible that everybody pays. So the cheapest plan is Plan G, the most expensive. That's the minimum cost if you never use healthcare. For Plan N, your annual cost for the premiums is $2,580. What your maximum possible cost is kind of unknown because you're paying copays. So if you never go to the doctor, your maximum cost is $2,580. If you do physical therapy 4 times a week, your costs are going to be much higher. So that's a way to look at the annual cost for the premiums. What's the minimum cost if you never use care for each plan? What's your maximum possible cost for each plan? But besides that, you have to think of the advantages and the disadvantages of each. So the advantage of Plan F is no bills, no paperwork, everything is covered. And that's why people like to choose it. They don't want to have to think about how am I going to pay for my medical care. They're phasing out Plan F. If you turn 65 on or after January 1st, 2020, you can't get Plan F anymore. Plan G is pretty much the same as Plan F, and that's the one that people are choosing now. Everything is covered after you pay the $226 Medicare Part B deductible. The disadvantage of Plan G is you do see a few medical bills until you've hit that $226 deductible. But we're used to that because right now, with senior care, we are all paying the $226 Medicare Part B deductible. The advantages of Plan G, of the high deductible Plan G, it is by far the cheapest plan if you're in good health and you use few medical services. The disadvantages are the bills and the paperwork that you have to deal with. And the more services you use, the more bills and paperwork you have to deal with. I first started looking at Medicare, Medigap plans when we were looking at them for my in-laws many years ago. And at that point, they were being pushed to take a Plan F because that's what everybody took. But we realized they were in very good health and they could save a tremendous amount of money with a high deductible Plan F. So that's what we actually enrolled them in. Unfortunately, we didn't reevaluate that. And after about 10 or 15 years, they were not in such good health. And the bills and paperwork were driving my husband bananas. And they were always wrong. And so he spent a lot of time fighting with hospitals and doctors. So at that point, we realized we needed to switch to a regular Plan G. And that's what we did for them. Now, that's another thing. Can you switch from one plan to another plan if it doesn't work out for you after a few years? In New York State, yes, definitely you can. In other states, I'm really not sure. I'm not an expert on Medicare. I'm not an insurance broker. So if you're considering something like the high deductible Plan G and you live in Florida, find out if your health needs change. Can you switch in a few years to a regular Plan G? These are things you have to figure out for yourself. These are things that you have to evaluate. Are you worried most about the cost, or are you worried most about dealing with paperwork and not having to, to hassle about that? So, that is what I figured out how to do. And that's the way I realize would probably make sense for most people if you're trying to figure out, what plan you should choose if you decide to waive. And again, you should look at the article about the cost of waiving New York City health insurance, because it's very expensive. You do wind up paying a lot of money. You lose the reimbursement for your Part B premiums from Medicare. You can always get out later if it turns out that the Aetna plan doesn't work for you. So you shouldn't think that you've got to make a decision right now or your life will depend on it. Unless you're in very poor health and you have a continuity of care issue and you're worried about that, everybody is different. Everybody has to figure out what works for them. And I will stop sharing my screen. And that's all I have to say. Hope it helps.
Thank you very much, Bonnie. This is not an easy road to navigate through. It does take a lot of time and thinking and effort on each individual's part. And I hope, we hope this is helpful. Well, on the welfare fund front, we're going to hear from Donna Costa and Michael Foley about the latest, which is good news, and any other information they want to give. So I don't know who's here, Donna, Michael, both of you.
I'm here. I'm here. Hi, Ann.
Hi, Donna, welcome.
Hello, Ann. Thank you.
Hi, Michael.
Thank you all. It's always wonderful to be able to attend these meetings. You have a lot of good questions. I think Bonnie and Debbie did a phenomenal job in giving a summation of where we are. Bonnie's explanation of the Medigap policies was for such a complex subject. Very well done, Bonnie. And Debbie compiled, they all really worked very hard on putting the FAQs together, and they're very comprehensive. And I think that they're written well, that as complex as it is, it makes sense. For the Welfare Fund, I'm very happy to say that on May 21st at the Board of Trustees meeting, that the trustees passed a clarification resolution. And the clarification resolution was to clear up some ambiguity in some of the language, the trust indenture language. The thought behind it was that the Welfare Fund, the trustees, were all, not all, but most of them were in agreement that the way it was written was never meant to exclude retirees that were not taking New York City healthcare. So the language was rewritten really very simply to make sure that any present retirees who are now going to waive New York City coverage will continue to get welfare fund supplemental benefits. The supplemental benefits are prescription drugs, dental, hearing, and vision benefits. The prescription drug benefits will continue for anyone that needs prescription drugs unless you are covered under another plan. And I just want to make a very clear point that no one who is employed by PSC, by CUNY, would need to opt into the retiree drug plan. Every one of you are eligible or should be eligible for the welfare fund drug plan. So be very careful that none of you mistakenly enroll in that plan, because there is I think it's $125 per person charge per month for that plan, and you do not need it. The catastrophic plan, we've been asked this question a lot about catastrophic plan. Catastrophic plan, the legacy plan, and I believe the NYSA plan it will still cover you for any extraordinary costs as long as you meet all of the eligibility requirements under them regardless. That means even if you waive your New York City benefits, you would still have coverage under them. I think one of the other questions I've seen in the chat room today is if your spouses are covered. Anyone who is currently enrolled in the welfare fund benefits will continue to receive their benefits even if they waive New York City benefits. Our enrollment and disenrollment processes are handled by the fund, not by CUNY, not by the city, not by OLR. So there is no crossover on if you waive benefits, you'll mistakenly lose coverage in the welfare fund benefits. So if you are eligible, if your spouse is currently listed as a dependent under you, nothing should change. You should not have to contact us to ensure it. As long as you know you're covered, you should still remain covered. If something were to happen, then you should absolutely contact us. I'm sure we would be able to find out whatever the issue was and correct it very quickly. I also wanted to take this opportunity to mention, because I'm not sure if I did at the last meeting, that Patrick Smith, who was our communications director for 17 years, retired in March. And I just wanted to introduce Mike Foley. He's our new communications director. He's been on board since November. If many of you I know have called him and spoken to him, and he is a great source of information. He picked up very quickly on all of the details and specifics and changes. This has been an ever-evolving process. The rules, the enrollment processes have changed so much from the time it was first anticipated happening to now coming down to the last month. And Mike has jumped on board, and we've been trying to keep on top of all the messaging. As soon as we heard about the May 24th Board of Trustees passing the resolution, Mike sent out an email immediately. We have a bulletin that's going out shortly. It was posted on our website immediately. So we're trying to keep the most up-to-date information that we have. But like Debbie, I do suggest that you go to the PSC's website. They have much more detailed information than we have. But I just do want to take a moment to let Mike jump in and say a few words.
Thank you, Donna. I appreciate it. I'm very happy to be with you all here today. As Donna mentioned, I probably have spoken with many of you. It's a very difficult time. It's unfortunate that you have to be burdened with this at the time, but there are many people who are looking out for you right now. The PSC, the retiree chapter here, Debbie and Bonnie and Ann have been doing wonderful work putting together some really outstanding documents that I would urge everyone to view, in particular the FAQs. I just want to emphasize one thing that Debbie mentioned earlier around the terminology. It's very important to understand that opt-out and waive are not interchangeable terms. Opting out means you may end up getting placed in the city's other retirement plan, the HIP-VIP HMO. When you do get the form, if you choose to waive your coverage, it's important that you designate, I believe it's box number 4 on the form that says you are waiving city health coverage. It can be difficult, but we're here to help, and I'm sure it will work out for everyone involved. Thank you.
Thank you very much, Michael, and welcome to the Welfare Fund and the world of the PSC. It's been a steep learning curve, and you've done it remarkably well. Anything else from our Welfare Fund people? I think, Donna, anything else? Are you finished? Okay.
No, I don't. I have.
Okay, they will take questions. That the news that is great news, and many people worked very hard to get that clarification into place. We're not going to take questions until our next speaker is finished. So I see some hands. I want to bring on Dean Hubbard, our executive director, to talk a bit about what the political landscape looks like, lawsuit, and whatever else he thinks we need to tell you today. Dean?
Great. Thanks so much, Anne, and good afternoon, everybody. I'm going to talk just for a few minutes about the lawsuit that was filed last week by the New York City Organization of Public Service Retirees and 9 individual retirees who are representing a potential class that would include basically all 250,000 New York City retirees. James covered a lot of the political landscape at the outset, so I think I'm going to just mostly focus on the lawsuit right now. What they filed was both a petition which started the underlying lawsuit and a request for a preliminary injunction. They filed it in state court. It was supported by a lot of affidavits, and they are alleging basically 10 different kinds of violations of the law by the city, the mayor, the Office of Labor Relations, and the commissioner of OLR, among others. I'm not going to go through all 10 of them. I'll just quickly tell you sort of the 4 main, what I see as sort of the main legal theories that they have. The first is they're saying that the city promised Medicare eligible retirees a combination of Medicare plus a choice of city paid supplemental Medicare plans, and that retirees relied on this promise to their detriment. That's like a legal term of art that means the retirees gave something up, for example, higher salaries that they could have made working in the private sector in exchange for this promised benefit. And it's a legal theory that's called promissory estoppel. Their second theory is that the decision to eliminate city-paid Medigap coverage was an arbitrary and capricious abuse of discretion because many retirees will face dangerous disruptions in their medical care. The third major legal theory, or what they call a cause of action, is that the city is forcing retirees to make a very, very consequential enrollment decision by June 30th without having provided adequate and accurate information. The fourth, and also very important, is they are arguing that eliminating city-paid Medigap coverage options violates the city administrative code, which they argue requires the city to pay for and offer a choice of Medigap plans. As I mentioned, there are several others. I'm not going to get into all of them, but I do want to say, because several people have raised this question, we have communicated with counsel for the retirees, and they have confirmed that they will be asking the court as part of their request for an injunction to find that any waivers of New York City coverage are of no force in effect if the court decides to go ahead and reinstate city-paid supplemental Medicare coverage. So that will protect people who want to keep their New York City coverage if the court reinstates city-paid Medigap. The remedies they are seeking include various kinds of damages and then an injunction against the elimination of retirees' existing health insurance coverage, automatic enrollment in Medicare Advantage, enforcement of the June 30th deadline, and implementation of any other aspect of what they're calling the new retiree healthcare policy. As of this morning, they have not received a hearing date on their request for an injunction. So that's what I know as of right now about the status of the lawsuit. And finally, I think in terms of the question about what can people do now in terms of action on this issue, I would say the main thing to do is to keep the pressure on the mayor to keep his promise and the city's promise to continue providing city paid Medigap coverage as the city has done for decades. And then there's the link here to sign on to the letter on the mayor on that issue. So I think I'll stop there and turn it back over to Ann.
Thank you very much, Dean. Okay, well, we're going to go right to questions. Because we have over 500 people on this Zoom meeting, I'm sitting here imagining what this would look like if we were all sitting together at Cooper Union's meeting hall, as the PSC has done in the past. We have met there, and the powerful message that sends for all of us being in that room together. But we're in the Zoom room, and we will we continue to do our work as we need to. So I see hands. If you want to ask a question, please raise your hand. There's a little hand at the bottom of your screen. I think you click reactions, that smiley little face with the plus, and it'll say raise hand. Okay, 1 minute per question. We're timing people, and answers, hopefully, our experts can keep their answers short also. I see Tony P. I don't know your last name. Tony P. Unmute.
Hi, how are you?
Good.
Good. You answered my question about my non-Medicare eligible spouse being eligible for the welfare fund benefits. My follow-up question on that would be, are new insurance cards going to be issued, or do we use the existing insurance cards?
If you're speaking about welfare fund,
Yes, ma'am.
welfare fund cards are not going to change because we are completely separate from any city or any other insurance you may have. So no, those cards, yes, those cards are good, and no, they will not be changing.
Okay, and then one other quick question. If I choose to waive the Aetna Medicare Advantage benefits, that form is online, correct?
That form is online at OLR, yes.
Thank you very much.
Thank you. David
welcome.
Miller. Unmute, please.
Yes, a quick question. My wife and I are going to opt out or waive and stay with the current Medicare. So my question is this: we'll wait till June 28th, June 29th to go on our website and sign the waiver forms and get out, because that's as long as possible. You guys said we should wait as long as possible. If now I've waived my benefits, and at some point down the line, August, September, October, the city of New York or the council agrees to pay the $2,000 a person Medicare premium, or offer some kind of a Medigap plan, am I out? Because I've waived my benefits, I'm no longer eligible for the $2,000 because I'm gone? Or does that, if that deal is made later on, am I held harmless and I can still get in on it?
I'll take that one. So yeah, we asked counsel for the New York City Organization of Public Service Retirees this morning about that issue, and they indicated that they are going to ask as part of their request for an injunction, that the court hold waivers to be of no force and effect if the court goes ahead and issues an injunction that protects city-paid Medigap. So that would allow people who've already signed the waiver to nevertheless go back into traditional Medicare and keep their city-paid Medigap coverage in the event that the retirees are successful in getting that injunction.
Thank you,
I
Dean.
think the question was, what if the council changes the law? What would
Same
happen?
thing, same thing. They're asking that the waivers be held to be of no force and effect.
Thank you. Lindak Iannuzzo?
Good, you got it. Thank you. Okay, 2 questions. The first one is, I've gone to a couple of doctors in the last 2 months, and I've been asking them if they're going to be part of this new program. They are not aware of it. I don't know what information to give them so that I can see if my doctors are going to be participating in this. What are we going to get that information? Otherwise, I mean, I have appointments that I may have to cancel if they're not part of the program, and then find new doctors.
Can somebody take a stab at that? Well,
I'll take a stab at it. I know that when I had seen the packages, and I do not have it at my fingertip, but in your enrollment packages, there should have been an attachment that with information that you could bring with you to give to your doctor. You can go onto the Aetna website, and I believe you should be able to find that information there. They had a number that you could give to whoever it is that you greet you when you walk into the doctor's office, that they can even call to follow up on it. But I did see a packet that actually addressed that.
and that would be on the Aetna website, or
It should be in the Aetna website, but I was also told it was in those packets. I believe you all received 2 enrollment packets from Aetna, and that should be in there, what to bring with you to when you see your doctor, something like that. I will try to check and see if we can send that information to, see if I can send it to Debbie, and they can put it on the PSC website.
And I just put the phone number for that, the Aetna phone number in the chat.
oh,
And
great.
you can call
You
that
could-
number and give the names of your doctors to the Aetna representative that answers, and they will check to see if your doctors are in the Aetna Medicare PPO. Also just popped up in the chat, a very common question is, what is this plan called? Is there a plan ID number and whatnot? That's a frequent source of frustration. It is literally just called the Aetna Medicare Advantage PPO plan. And if your doctor is confused about it, you could say it's for New York City retirees.
Okay, thank you. Bruce Brown? Is Bruce there?
Yes, I am. Thank you. I have a couple of questions. One is a simple one. Can someone please define and tell us the implications for pre-existing condition exclusion and underwriting? And the other question I have concerns continuity of care. I already spoke with you, communicated with you, Ann, about this. Aetna will not tell us anything now before the June 30th deadline about continuity of care. So we have to trust them that they're going to provide it after that when we apply for it. I guess my question is, if we do apply for it, how do we make sure that we can get to them if we have to call them? I'm a little concerned that they're going to be overwhelmed with people calling, and I'd much rather have the option to send something to them by email. I know that's going to go through. I'm concerned about this business of communication after June 30th if I take that plan. Do we have any control
And
over
I'll
that?
try to
Yeah, okay,
answer
Debbie.
those questions. On continuity of care, you're absolutely right to be concerned. And we are going to raise with Aetna something about how to communicate, because the what they told us, and we've confirmed it, is that the federal regulations don't permit Aetna to advocate with providers and between providers and patients until the patient, the retiree is actually enrolled in the plan, which will not happen until August. So you're right, there will then be a flood of inquiries in August, and how will they handle it? So we're going to work to try to address that communication question, and I think your idea of being able to have emails is a good one. Pre-existing conditions. By and large, I believe those are defined by the insurer or possibly by the state. I think you could, in the event you are communicating with anyone about continuity of care, you could inquire if whatever medical issues you have constitute a pre-existing condition. Alternatively, you could try calling the Medicare Rights Center, whose number is in the FAQs.
Thank you, Debbie. Barbara Backer. Unmute, please.
Yes, can you hear me?
Yes.
Okay, 2 points. One is I did call Aetna to opt out, and the representative I got said that I could opt out over the telephone. I did not have to fill out a form. Is that your understanding?
Are you talking about opting out or waiving?
Opting out.
By opting out, do you mean you want to go into HIP VIP?
No, I know I have to fill out the form for OLB. That's a different form, but this is just opting out of Aetna.
No.
No.
Don't talk to Aetna. If you want to waive your city coverage, you do not want to go into Aetna Medicare Advantage. You do not want to go into HIP VIP.
Yes, I understand.
Only fill out the form.
Yeah, I understand that, but I do not have to let Aetna know I'm opting out.
No,
Okay,
no, you are waiving. You are not opting out. You are waiving city coverage.
okay, and that takes care of Aetna. I'm out of Aetna, right?
Yeah.
Okay, thanks.
And just to follow up on questions in the chat, the city has told us the city receives those waiver forms and will be sending confirmation letters of receipt of the waiver forms July 1st of 23, so the day after the deadline.
Okay, thank you.
Okay, thank you very much. Palmer Tome.
Yes, that's my spouse. He's here with me. If we waiver the coverage and choose Plan G, we have to pay $282 a month for coverage. Is that taken out of our monthly Medicare or Social Security, or will we be billed monthly or quarterly?
It is my understanding you will be billed by the insurance that you select. Again, Medigap plan rules vary from state to state, but that's my understanding.
And my second question quickly is, will we ever have a meeting where we meet instead of just a Zoom?
Will we ever? We may. Would you like to? We may have a meeting where we meet together, and we have spoken about that. Bob Cowan. You have to unmute, Bob.
Thank you. Look, a lot of us are very angry and we haven't given up in this fight. So I would, if those of you who are angry, I invite you to join us on the Safety Net Committee. We need and welcome your input and ideas. We're still hoping to fight back and overturn this horrible, horrible decision by the city. We can't let them get away with it. Join us and let's fight back. Thank you.
Thank you, Bob. Maxine Wolf.
I was just wondering, Bob, do you want to share the date of the next meeting? How can people get involved in that committee?
Somebody put it in the chat, Jim Pearlstein or Lolly, put in the chat the next date of the social safety net meeting, please. Thank you, Ava. Maxine Wolf.
Thanks. First, just want to say thanks for all the work that people have done. It's pretty amazing, given the complexity of all of this. I just want to make sure, because everything that's on the chat and people have said, we do not have to opt out of it. Is that true? If we want to go keep our Medicare coverage and get a Medigap policy, all we have to do is fill out the form that waives our health care with the city.
That is correct.
Okay, excellent. And the other thing is, when does everything go into effect? I know that the Aetna contract has not been signed, so technically it doesn't even exist. So if we waive out of our city benefits on June 29th, for instance, that actually doesn't take effect until the Aetna thing goes in?
Correct. So right now that's scheduled for September 1st. So if you're going out and negotiating, trying to find a Medigap plan, the effective date of that plan would be September 1st of 23.
Right. And for someone else who asked a question about how, on the chat, about how easily you can get out of a Medigap policy if you have to, I asked United Healthcare that question, and it's really just a few days. It doesn't take forever. So
right. Basically, how health insurance works is, in these cases, when you're dealing directly with private insurers, is you give them notice. You are covered until the end of that month.
Right.
And you should, revert to something else the beginning of the following month. But you should be, if you take that action, you should be absolutely clear that that's what's going on, because there are three parties involved. There's you, or you and your spouse. There's the insurance you're getting out of and the insurance you're going into. So you have to make sure that everything fits together.
Right. And I was basically wondering if we were going back to city coverage, I don't know how long that takes.
Their general rule is they pick you up the following going back to city coverage would be going back to Aetna Medicare Advantage, most likely. And that would be picked up the first of the month following when you pull out of a plan. Sometimes if you pull out at the end of a month, it will take until the beginning of the following month, but the plan you are pulling out of should continue to cover you.
Okay, thank you very much. And again, thanks everybody for your work.
Thank you. Irving Markowitz.
Thank you. 3 questions. Marianne Pizzitola of the New York City Organization of Public Service Retirees has led a lawsuit that we are all very much aware of. My first question is, what have we done, or what could we do to have instigated a lawsuit, actions to stop the city from taking us to Medicare Advantage? The second question is, since there is this lawsuit now in existence, how can we help fund the lawsuit or in any other way be helpful? I have given a personal donation to the organization, but I wonder if we can't do something more as an organization to help this lawsuit proceed. And thirdly, what can we do, again, as an organization or individually, to help better inform the rank and file of those unions of the Municipal Labor Council about what their leaders have done in selling them down the drain in buying and opting and approving Medicare Advantage over Medicare?
Okay, that's 3 questions. I don't know if James is here or Dean wants to take the question about the legal stuff.
I think James is still here, and I think he can answer the questions about the lawsuit in support of it. At least he was a few minutes ago.
James?
And if not, I can take it.
James needs to be unmuted, I think.
Aha, there, I'm audible now.
Yes. James.
Irving, thanks. I'll ask Dean to speak about some of the legal elements of it, but thanks for the question. Taking the last part first, I think we have made a number of efforts pretty consistently to try to inform our members, not only retirees, but also our rank and file members, about the particulars of the of what's happening with retiree healthcare, because it's not only current retirees who are affected by this, it's all the retirees in training, so to speak, and it's really an attack on public sector workers. And I think we've tried to be pretty consistent and clear about that. One thing we have refrained from doing, and I think I hear this in your question, and I know this may be a source of frustration for some people, but we have not taken positions that are directly critical of other labor union leaders. And I understand that some would like us to do that. I think that as a general practice, even though we may have sharp disagreements, that we don't want to make public statements of condemnation against the leaders of those other labor unions. We want to fight to try to change the policies. And at the end of the day, we all know that it was actually under previous mayoral administrations that these agreements got pushed through and signed. Some of you will remember that candidate Eric Adams sang a very different tune about Medicare Advantage when he was running for office than he did once he became de Blasio's successor. So, we really think that the mayor should be the target. And I think, we'd be happy to look at the theories in the legal case that the Public Service Retirees Group have brought forward. And yeah, I mean, I think Dean can probably answer the question about the amicus brief. The question about donation of funds is an important one. I would just remind everyone that when we do that, whenever we make contributions, we're making a decision about the contributions of our members' dues. That's really what the resources are for this whole organization. It's not the retirees chapter budget, it's the dues of the entire membership. So we would just have to think hard about where those dues go and when. So Dean, maybe you want to say more.
Sure. I've said in a couple of previous meetings, in any coalition, every organization plays different roles. I think if you look at what the PSC is doing compared to what other unions are doing, I don't think you'll find any other union that, for example, has hired one of the most highly qualified experts on health policy in the country to help us with this fight. We have the former president of the PSC helping us with this fight. We have the former executive director of the PSC. You can see the president, James Davis, has been consistently engaged. We have engaged the council. We have engaged the mayor. And we have fought this fight in the way that we think is strategically smart and in the interest of retirees of the PSC. We're in contact with the lawyers for the New York City organization, the New York City Organization of Public Service Retirees, and they're playing their role in the coalition, and we're playing our role, and I think we're doing it very effectively.
Thank you. Fran Gatellis Shapiro. Unmute. Okay.
Yes, I did that.
Okay.
Yeah, I was wondering, this is different from the other topics, I think. Does the new plan, whichever one we take, the Aetna or the sticking with the traditional Medicare, does it affect a situation of hospitalization or an extensive medical procedure in a hospital? Will those still be covered? Will we now have larger deductibles? If they are covered, how does that fit in?
I will try to answer that. Although I just hesitate, it's hard to answer such a general question accurately. But Medicare pays a set rate, whether it's to the Medicare Advantage plan or directly to the hospital for procedures. There will not be an enormous deductible under the Medicare Advantage plan. There will not be some vast increase. The one concern that has been expressed about Medicare Advantage plans generally is their practice of requiring prior authorizations for a lot of procedures. The contract with the City of New York, the city is paying for Aetna to reduce the number of prior authorizations that they will insist upon. Most of those being reduced are sort of outpatient screenings and things like that. So the prior authorization process is a difference with regard to inpatient procedures, but it's without specifics, it's really hard to comment.
Jane Mushabak.
Hi, thank you, everybody who's working on this terrible conundrum, and all of you asking questions as well. I feel like my question must have a very obvious answer, but it eludes me, so your help. What if someone is in a union without access to the PSC welfare fund, which I assume would be many people? When they go on Aetna Medicare Advantage, will a drug benefit be included for them? I'm asking because I don't quite understand whether Medicare Advantage has been set up to include a drug plan, and just people in the PSC won't need that part of Medicare Advantage if they join Medicare Advantage, because we'll have it through the welfare fund. Am I missing something very basic here?
No, you're not, Jane. A number, PSC retirees, DC 37 retirees will continue to get their welfare fund benefits, their drugs through their welfare funds. A lot of other union represented retirees do not have access to drug coverage through their welfare funds. For them, a drug plan is what's called a Part D drug plan is in fact part of Medicare, the Aetna Medicare Advantage plan, and it will take effect January 1 of 24. But PSC retirees and their dependents do not have to worry about that.
Thank you. Alicia Villafani.
Yes, I have a kind of a three-part one for clarification. I understand with the recent trustee decision, the welfare issues of prescription, vision, and dental are okay. In regard to IRMA, is that in or out if one chooses not to join Aetna? And if one waives out, are we also liable for the 163 that was usually, when we were earlier discussing per month? That's why so many people were in a quandary as to whether it would be to their advantage to stay in, to go with Aetna, or to stay out. But one of them is IRMA. Is that in or out? Or in other words, will that be part of the welfare and the discussion with the trustees? Or if one waives, will one lose the IRMA?
That's right. If you waive, you lose the IRMA.
Okay, and then with the monthly that originally of the 163, that was a discussion per month. If one were to waive Aetna, is that still in effect at this time or?
The 163 will continue to be deducted from your pension check. You will not, however, be reimbursed by the city for that, which you have historically.
Okay, and also not reimbursed for the IRMA either?
Correct.
By waiving?
If you waive, correct.
Okay, so we basically have only the vision, dental, and prescription at this point. Is that correct?
You have all the welfare fund benefits. The
All.
IRMA and Medicare Part B are completely separate.
Okay, all right. Thank you so much.
Thank
Yes.
you. Emil Chi?
Yes, thank you. I have 3 questions. I think I'll ask them one at a time to avoid confusion. The first one is to Dean Hubbard. You keep referring to the lawsuit on the Medigap. Is the lawsuit also covered keeping the traditional Medicare, or is it only about the Medigap? I'm confused about that.
Sure. So everybody has a right to stay in traditional Medicare if they want to. As Debbie's been explaining, the way to do it is you have to sign a waiver form with OLR. And then, yes, you retain the same legal right that everybody has in the country under federal law to pay for a Medigap policy. The problem is that for decades, the city paid for the Medigap policy. And now the city has changed its policy in an effort to try to force everybody into Medicare Advantage. And they are saying they will no longer pay for Medigap coverage. And so that's one of the things that the retirees are looking for in the lawsuit, is to try to force the city to continue to pay for Medigap coverage. We're also doing that politically by trying to pressure the mayor, who has the option under the contract with Aetna, for the city to keep paying for Medicare, for Medigap.
Okay. Emil, we've got a lot of people waiting to ask questions. So if you can put your other 2 questions in the chat, that would be great. Linda Gilberto.
Hi.
Hi.
My husband, I'm on my husband's policy as his dependent. I need to waive my coverage because I have continuing treatment down here in Florida that I have to continue with my current providers because of my health condition. However, my husband wants to move to the Aetna Advantage plan. We understood that that was possible, but when we look at the form that Mike Foley referred to about checking box 4, it says in that, if my husband fills this out, I wish to waive or terminate my city health benefits. I understand if I waive benefits, my covered benefit dependents and I will no longer have city health coverage. So it seems contradictory. How do I stay in? How does he stay transferred to the Advantage plan, but I transfer to my Medigap coverage?
I can jump
Linda.
in on that. I don't know, Debbie, do you want to take it?
I cannot give you a definitive answer.
I think
If you will put your email address in the chat, I will talk to the city. Because
Okay.
what the
Debbie?
city stressed was a spouse cannot stay in cannot get coverage if the retiree waives. They didn't explain it clearly the other way, so let's not assume and I'll ask and get back to you.
Okay, thank you.
Can I just jump in for a moment? Do you have your own coverage? Are you also a CUNY or a city retiree?
I am a city retiree, but I didn't work for the city long enough to be eligible for benefits under my own
Okay.
work.
Are you under 65?
No, I'm over 65.
Because eligibility for any of the city coverage is dependent, for a dependent follows the primary retiree. You are only entitled to benefits through him. You can't split coverage. They did have this addressed at one of the meetings. So if a member, if a dependent of a member decides that they want to waive, they can't. They have to follow their spouse because their eligibility is directly tied to the spouse's eligibility. Just like if he died tomorrow, you would not be eligible for any benefits.
I understand that, yeah.
Okay, but put your
I'm going to put my
information-
email just in case there's an answer I like better.
Yes,
out there
Ed,
somewhere.
okay, great. Edward Brungnack.
Hi. Hello.
Hi.
Yeah, well, first of all, thank you very much for your hard work. And I have two questions. If I do choose to waive out, or to terminate, when should I buy Medigap? And then what's the best way to submit the waiver form? Do you scan it and then submit it to the, I don't know, I wouldn't know how to do that.
They ask you to scan it and submit it by email.
Yes.
I think you can. If they give an address, I would suggest that you can mail it in. It's been a while since I looked at that particular page.
Debbie, I've looked at it a lot recently. Edward, you have basically three options. You can scan it and submit it electronically. You can print it out and mail it, or you can print it out and fax it. Those three instructions are in the top right corner of the form itself.
Okay, oh, I see. Okay, I'm looking at the form.
So good.
Okay, and also, like my first question was, if I choose to terminate, when should I buy my own personal Medigap?
The effective date of your personal plan should be September 1st. So I assume you should start looking around and seeing what's available and consider and talk to the insurer.
Okay, thank you.
Beth Rosenthal. Hi, Beth. Beth, you need to unmute.
Yes, I just got it. Hi, I have two questions. One, what, if anything, is going to happen to the catastrophic plan as a result of all the new Aetna plan? Will it be affected, and if so, how?
The catastrophic plan is a standalone plan and it's not affected. It has the same eligibility as it had prior.
Okay, great, thank you. The other thing, just so I'm absolutely clear, if we go with the new Aetna Advantage, Blue Cross, we no longer have Blue Cross, or we do have it, or Aetna covers that hospital now?
Aetna covers that.
Okay, so we don't have Blue Cross anymore?
No.
Okay, thank you.
Alan Houseman. Alan, okay,
Can you hear me?
yes.
I'm sorry I'm ignorant about this, but what is the catastrophic plan? I don't know what it is.
The catastrophic plan is a very old legacy catastrophic plan that has been closed, I think, for members to opt into that program. I think it goes back to almost 2006, but it was originally called the $2 million catastrophic plan, if that rings any bells with you. So if you are presently enrolled in it, you would still carry that coverage with you, but there are no current enrollments in it. We can, if you want, you can take a look on the Welfare Fund's website, and there is under forms, you can look and see what the catastrophic program is. There's a pretty good description of it there.
Thank you.
Welcome.
Okay, Catherine Costa.
Okay, I think it's been answered, but I had a catastrophe, or what they call, I was taken by ambulance to the hospital. I'm in ongoing physical therapy that's important for me to continue for 6 months. And I'm concerned that I go to HSS because that's the trauma center from the accident. And I'm worried that I won't even be able to use HSS with Aetna, nor will I have continuity if on August 31st, I find out that Aetna will not let me use them. I know it's been asked before and it's very specific. If you can give me any help on that, I appreciate it. I will do my research also. Thank you.
Aetna tells us that they have all the hospitals in the New York metro area, including HSS, including MSK, in their network.
I see.
They have also, Stony Brook was not in their network, but they tell us they're negotiating with Stony Brook to be part of it. Now, the trick is that individual providers associated with some hospitals may not accept Medicare, but if your provider is at HSS currently accepts Medicare, it is likely that they will be in the network, because apparently about somewhere between 40 and 50% of HSS, what they say doctors, and that may not be your physical therapy provider, will be in network. But I suspect if you're getting physical therapy at the hospital, that's a hospital-run program, and therefore it's likely that that will be in the network. You can call Aetna in the number that's been posted and give the name of the particular provider or particular therapy program, whatever they're called, and see if they can confirm that specifically. But if you ask the provider, you may run into the kind of problem that everyone else has run into, which is that the providers themselves aren't even aware of this new plan yet. So they don't know.
Thank you.
Thank you. Cordelia Reimers. Unmute, please. Is Cordelia? Okay.
Yeah, can you hear me?
Yes.
Okay. I wanted to know how the spouse coverage will work.
For some reason, there's feedback. I don't know why.
I don't know why. Let's see. Can you unmute me on a different?
Ava, any suggestions for Cordelia?
Are you attached on like two things at the same time, like a phone and a computer or something?
My computer is giving feedback, but I can do it just on my phone.
Well, you should turn off the volume on one of your things, like turn off your computer sound.
I had turned.
I don't think so, because it's still, there's two things getting sound. Could you write your question in the chat?
Put your question in the chat, please, Cordelia. Put your question in the chat, please. And in the meantime, I'm going to go to Alberto Bird.
Hi, can you hear me? Hello, can you hear me?
Yes, Alberto, yes.
I don't see myself, so.
I see you.
I just want first thank you to the PSC leadership and to the Retirees chapter leadership for everything you do. I wanted to mention, because I haven't heard it today, that on Thursday there is a rally at 1 p.m. It starts at noon, actually, down at City Hall, sponsored by the New York Retirees organization. And I think it's really important to show up to these things. And I think there's a numbers speak. And I believe, I think they think we're a bunch of old fogies who can't get anywhere, and they're pushing us. And it would be great if PSC members could join this rally and make a statement. There is a council meeting that's happening at that time. They're gonna broadcast it be a live stream. I believe they are going to be inside the meeting, putting pressure on the council members. And so I urge everybody to show up at 12 noon on Thursday at City Hall. Thank you.
Thank you, Alberto. I just want to say, questions in the chat will be looked at later on. There are loads of questions in the chat. One specific person did I ask her to put her question in the chat, and that was Cordelia. And if Cordelia has her question in the chat, then we can try to get her an answer now. Joyce Mormon.
Okay, I am in HIP. I've been in HIP for 20 years. Will I be automatically switched into the Medicare, the Aetna Medicare Advantage plan?
No. You will be in, you will stay in HIP. Anyone
Okay.
who was in HIP as an in-service employee, stayed in HIP when they retired, will stay in HIP now.
Okay, now if I change my legal address this year to another state that's outside of the HIP coverage area, then I need to change. I need to get out of HIP and go with the Medicare Advantage plan. And how do I do that?
You fill out a form, talk to the people at HIP,
Okay,
but I assume what you do is you fill out this form that we're not the special form, but the regular form, because you want to give them your new you want to give the employee benefits program at OLR your new address, and you will fill out a form asking to change plans.
okay.
Okay.
Thank you.
Okay, thank you. All right, Debbie, I see Cordelia has put her question in the chat.
Okay. I will say, let me say that because I review the chat after every meeting, we respond to specific questions. It is, if you are not a PSC member, retiree chapter member, we may not have your email. So put your email address in the chat. If there are some general questions that are answered in the FAQs, so there are occasions when we don't send specific answers because the answers are in the FAQs if you would go and read them. Okay, that's just our general approach to this.
Thank you. Audrey Cohn.
I have two questions about the legal case. I didn't hear that as part of the case, they were asking for the city to continue reimbursing Medicare Part B and IRMA. I only heard about providing an option for Medicare, Medigap coverage. So that's one question. And the second question, since Dean said that the Organization of Retirees is asking that if there is an injunction, then anybody who waived New York City health benefits would be put back into regular New York City health benefits, then why is there an advantage to wait till the end of June?
Thanks for those two questions, Audrey. The injunction request for relief is very broad. So the first thing they ask for is an injunction against the elimination of retirees' existing health insurance coverage. And within the ambit of existing health insurance coverage would be Medicare and IRMA, Medicare Part B and IRMA reimbursement. The reason it still makes sense, I think, to wait until closer to the June 30th deadline to opt out is that there is a good chance that the retirees will get a hearing on their request for an injunction before that date. And if the court acts on the request before June 30th, you'll have more information, i.e. either the judge will have granted all or part of the injunction or will not have granted it. And that would inform any decision that you want to make by that date.
You're muted now, Audrey.
Oops, she's muted again.
She's muted again. All right, I can't hear you. I'm gonna go to Richard.
For
Hammond.
non-legal people, what does an injunction actually mean? Does it mean the city cannot go ahead with this plan at all, or pending further negotiation, or what is the meaning of an injunction?
So an injunction is an order by a court to a party to do or not do something. And at this point, I can only tell you what the retirees have asked the court to do. The court will decide what to do that may be all or part or none of what the retirees have asked for.
Thank you very much.
Okay, thank you. Okay, folks, it's 20 of 3. We've got about 20 more questions. We'll try to move as quickly as we can. Richard Hanley.
Yes, I have a question about the Irma and Part B. And other than coercion, I am not clear on the reason why the city is not offering that anymore to retirees who waive to not have Medicaid disadvantage. So is it just coercion? Do they have a rationale for it? That's basically my question.
Debbie?
They say it's the law. They say the administrative code, the city's position is that the administrative code requires that to reimburse Medicare Part B and Irma, retirees must be in the city health plan. That has never been challenged, but that is their position, and that's what they've pursued.
So they're just making an assertion, is that correct? They're just asserting that, and so there hasn't been challenged, is there law on it?
Not to my knowledge, it has not been challenged to my knowledge. Also, I will say, in answer to a question that was asked, the reason you keep paying Medicare Part B, even though you're in Medicare Advantage, is that money goes to Medicare. Medicare in turn pays the Medicare Advantage plan to provide your coverage.
And I would just add to what Debbie's saying, that I think that the retirees lawsuit and request for an injunction is challenging the city's interpretation of the law as the city's basically saying we have the right to eliminate your choices of city paid Medigap and to put everybody into one plan. And the retirees are saying, no, the city doesn't have that right under the law. And they're asking the judge to decide who's right.
I see. Okay. Thank you. And the fact that the city with Part C could have
option C.
The mayor could have opted for Part C, and that was in the contract that was negotiated, would seem that could have been a possibility.
Yes, that could have been a possibility, and that's what we were pushing for. We had a big rally pushing for that, but we have to move on. Thank you.
Okay, thank you very much.
Thank you. Jack Hammond. Can you unmute, please, Jack?
Okay, now am I unmuted?
Yes, you are.
Yeah, I'm retiring this semester, so I need to know, what choices do I have to make? How are they different from what people have been saying here? And when do I have to make them, and when do they take effect?
Okay.
So you basically have the same choices everybody here does. You will remain in your current health plan through the end of August, even though your retirement date may be the 25th or the 26th. You will be automatically enrolled in Aetna Medicare Advantage, but what your college HR office should give you, as they give everyone, is the employee benefit, the city OLR Employee Benefits Program enrollment form, which includes a place where you can waive city coverage. In which case you would, and I assume you have signed up for Medicare Part A. If you haven't,
Yeah.
you should.
I
And
have.
then the CUNY HR people will tell you to sign up for Medicare Part B. So you will be covered by traditional Medicare, and should, if you decide you are going to waive city coverage, like people who are already retired, go out and look for a Medigap plan that satisfies what you want.
Okay.
And when do I have to do all this by?
Well, you should start now. I mean, the effective date of your Medigap plan would be September 1st, 2023.
Thank you.
Okay. Thank you. Anne Agranoff? You're looking to see how you can unmute yourself?
It says I
Yeah,
can't.
you're okay now. Talk.
Oh, okay. I was going to just continue with Medicare Advantage, but I've been hearing horror stories. So I think I do want to change. I found out we can go back onto my husband's, the plan from my husband's former employer for about $500 a month for the two of us, which I think is, you know, comparable to the sort of private plans that are up there, but they have a 3-month waiting period. So even if I filled out for that right away, there would it still couldn't start till maybe October, if I'm understanding this right, and it's usually by the beginning of a month. So is the easiest thing for us to just go into Medicare Advantage for a month or for 2 months and then go on to my husband's plan so that we don't have a period of no coverage at all?
You will have, if you were to waive Aetna, you would have traditional Medicare coverage. That doesn't go away.
But I wouldn't have any.
You
Part
wouldn't have
B,
the supplemental. So yes, you can, because you can disenroll from Medicare Advantage at any time, you could go on, you could be automatically enrolled and then 2 months later disenroll.
Okay, yeah, my husband has a lot of health problems, and I've been hearing horror story after horror story about Medicare Advantage, and he already almost died because the prescription plan wouldn't put him on the drug his doctor wanted him to use, and that was our good Silver Script prescription plan.
Yeah.
Still didn't want to pay for an expensive cancer drug, but we finally got it. So
And
glad we keep
we're
it.
all very sympathetic to that situation, and I hope that you make the best choice that you possibly can. Janice Dunham?
Hi, I just wanted to know, when the welfare fund decided that they would continue to pay the benefits for us, did they have any caveat as to, well, for the time being, or until we run out of money, or was it, I know it's impossible to say actually what will happen in the future, but at this time, were there any conditions?
There were no conditions. There was, as I mentioned when I first spoke, there was a bit of ambiguity about the way it was written, that led people to believe that there might not have been coverage, but it was thoroughly vetted by the welfare fund attorney and the executive director, the executive officer of the welfare fund and the board of trustees. Went through exhaustive search on it to see that its members have always been covered, the retirees have always been covered. So we feel pretty confident that that would not be changed. Although there is always, the fund is fully funded. We have a nice fund balance, but of course we always would look to see if anything extraordinary is happening, if we needed to make changes. But I don't see anything like that on the near horizon.
Thank you.
Okay, thank you. Okay, it's 10 to 3, and we have about 15 more people on the queue. I want to know, Debbie, Dean, can you stay a little past 3, or do we have a hard stop?
I have a hard stop at 3.
I
Okay,
can stay.
you can stay. All right, well, if there are questions for Dean that come up after 3 o'clock, you'll just
Yeah.
have to put them in the chat.
Yeah, put them in the chat and Debbie will let me know.
And
answer
I
'em.
would say, I think we need to go to 3:15 and then tie up, and any outstanding questions could be put in the chat. Janet Speckman.
Again.
You were unmuted. Try again. You're unmuted now.
Okay.
Yep.
With this injunction, I have no idea how long they wait, but courts are never fast. So if the injunction doesn't go through or doesn't get decided or whatever it is until after September 1st, that means we've waived out and we've joined another supplement, we've joined another insurance company. And then if the injunction goes through, then we can go back to the coverage we currently have. I mean, it seems like we're going to be going back and forth possibly. Is that true?
Well, I mean, it's hard to predict, and that we're going to be watching very closely what happens day to day. And we're probably going to have to set another meeting a few weeks down the line, which I'll talk about at the end, to see where we are.
I think it's a reasonable question, Janet. The goal of the lawsuit, as I understand it, and Dean can correct me, is to urge the judge to decide before September 1st with regard to a temporary restraining order, because then senior care will no longer exist. What do you go back to? Blah, blah, blah. You're right. I mean, it's a reasonable question.
It is. Sandra Letoff. Sandra Letoff.
My question is for those who are waiving rights, and we're applying for New York State Medigap. We need to prove that we have 6 months of previous coverage in order for our pre-existing conditions to be covered at the time. How do we get proof? Who will send us proof that we have had continuous coverage for the preceding time from September 1st?
We raised this question, I think you froze,
Back
but we
for the
raised this
6
question
months.
with the city, and Emblem Health will be sending to senior care participants termination of coverage letters, which, I mean, they're in the insurance business, so they know what these letters should say. I haven't seen it, nor have they told us when they will be mailing those.
But that's a serious problem for us who need
Which
to
I
have our
understand.
yeah, that's really serious. So I can't even let that one go, as that's not okay, because we need to know that that 6 month data is in there, not that they might provide it. I got to do this now.
I understand.
Yeah, okay.
In that event, you can, because the city's first answer was use the March 10th letter from Renee Campion and combine that with 6 months of statements from senior care. We said no good. But we will keep reporting on the retiree website as we press for better information and more prompt response.
Okay, and then what could the individual do to meet I need to meet my own needs on this one. What can I do?
I would suggest contacting Emblem Health.
And can you provide that contact information?
Not off the top of my head, but I guess we could put it on the FAQs.
That would be great.
Okay.
Okay, thank you.
Okay, thank you, Sandra. Mark Levine.
Hear me okay?
Yes.
Hello, hear me? Okay.
Hello. Yes.
This question was asked before, but I just wanted to make sure. Is it possible, given that the PSC is, the welfare fund is extending the benefits to people who waive their coverage, can the welfare fund go bankrupt? I mean, you know, there's a lot of people involved here. I'm just concerned that I know, hopefully that won't happen, of course, but nevertheless, that would be a real issue because we'd be out in the cold. I mean, because unions have gone bankrupt.
Believe me, we seriously, I take it very seriously, watching over the finances of the fund. I was a CPA, so I have the background to be able to look at the financial records. I can tell you that there's a very small percentage of people who are waiving, but we will, as we always do, keep an eye on the management of the funds and the funds that we have available. But at this point in time, as I said, the fund we have sufficient funding, and the money that is given to the fund is supposed to be spent on our members' health care. That's the whole point in having the fund money, is to actually spend it on our members. With that in mind, we keep an eye to the future to make sure we have enough money to continue this, and we keep an eye on the funding that we receive from CUNY. And that is part of what the PSC works very hard for when they do the contracts with the city, to make sure that the welfare fund continues to get the per capita funding that we get. And the fund's job is to make sure we spend it wisely. And the trustees are there to keep us all making sure that we are looking at that goal of what we were there to do. I hope that answers the question.
Right, yeah, it does, but I'm still concerned that,
All
you know,
right.
as you get closer.
Mark, we have to go on, and
Okay, I understand. Thank you.
I mean, in fact, the welfare fund has been able to increase some of our benefits not too long ago. So let's not try to catastrophize
Okay.
with
It's
more things to worry
It's
about.
not a small thing. It's not a
Take the
small thing.
gift and Donna and all the people involved in the welfare fund keep a very, very close eye, and perhaps
Okay, all right.
we need to learn a little more about the welfare fund, but not today.
Okay.
Walter Daum, or whoever that is.
Hello, I'm Susan Daum, Walter's wife.
Susan.
Can you hear me?
Yes, Susan.
My question was the opposite of what somebody asked previously. If we don't waive and we stay with Medicare Advantage and the lawsuit is successful, are we automatically back on or we can get back on the Medicare and Medigap provided by Emblem Health? Will there be a procedure for us to go back to the original situation that we had if we're in Medicare Advantage from the?
The request for injunctive relief asks that the judge issue an injunction that would against the elimination of retirees' existing health insurance coverage. So that's a very broad request to put everything back to the status quo.
Okay.
Okay, thank you.
Thank you.
Okay, Sherman Heller.
We can't hear him.
Can you unmute, please, Sherman?
Ed,
Okay.
you hear me now?
Yes.
Do any of the Medigap plans provide silver sneakers or some fitness program? And are we currently responsible for co-pays if we see physicians now?
I think you have, I don't know if they provide for silver sneakers. The ones I have looked at do not, but I wouldn't say that's an across the board answer. The co-pays that we were paying, the judge ruled in January that the co-pays under senior care should not have been applied. An appellate court upheld his ruling. So co-pays will not be charged by senior care between now and August. There are, however, co-pays.
Prior ones?
Excuse me?
How
I don't
about
know
the
what they're,
private?
I haven't gotten an answer on what they're doing about reimbursing for the 6 months or so that or year, I can't remember how long it was, that we paid them. But we are looking into it.
Thank you.
Aetna, however, has copays. That is a different contract and that plan is not covered by the judge's ruling.
But it does have silver sneakers.
But it does have and it also has silver sneakers, yes.
Thank you.
Okay, thank you. Henry Hermo?
Hello, and thank you. You hear
Hello.
me?
Yes.
Aetna has enumerated a number of radiological testing that does not require pre-approval, MRIs and such. It is my understanding that the city is subsidizing Aetna to allow for that. The contract in the city with Aetna is for the rest of this year and 5 more years. But my understanding that the city is only going to do that subsidizing for 2 years. Does that mean after that period of time, those kinds of pre-approvals will be then necessary?
There is no firm deadline in place. What the parties have agreed to in the contract is that the city and Aetna and the MLC will review what has happened over the first 2 years. So what we know is that the subsidy to eliminate prior authorizations is in place for 2 years. They claim it'll stay in place for 3 years after that. That is their intention, but they have the right to review after 2 years. Putting those prior authorizations back in place would have to be agreed to. Aetna cannot do it unilaterally. The city and the MLC would have to agree to it.
So that's open-ended then.
So it's open-ended, exactly.
Okay, thank you.
Can I
Rosa?
have just for the good and welfare of the House, one final time, waivers and opting out has been used almost interchangeably sometimes.
No.
I know they're not the same. Could we just?
They are not the
one more
same.
time?
The word we should be using is waive.
If you do not want to be in Aetna and you do not want to be in HIP VIP, you should waive city coverage.
And the opt-out is only for the HIP.
Is only if you are not in HIP VIP and you want to be in HIP VIP rather than
Right.
Aetna.
Okay, so we're waiving if we're doing.
Waiving.
Rose
Got
or
it.
Kiz?
Hi.
Thank you, Henry.
I just wanted to mention that I had to check in for an appointment that I have at HSS this next week. And they suggested that I look at their website to see what insurance the hospital takes. And I did that. And it says under Aetna, that Hospital for Special Surgery is an in-network provider with the following Aetna programs. And the PPO is mentioned, but then there's an asterisk that says Hospital for Special Surgery is not an in-network provider for Aetna's Medicare Managed Care Advantage. So I'm kind of.
That's a different plan.
Oh, okay.
This plan is not in effect until September 1st. So it won't show up anyplace. It's not in effect until September 1st. That's why there is no plan number. That's why they won't talk to people about continuity of care.
Okay.
And that's why we're also frustrated, but that's.
Yeah, because there was also, when I did call Aetna about something.
Yes.
And it was also about their Aetna PPO.
It doesn't exist.
Concerning, okay, okay.
All right, thank
okay.
you, Rose. Martha Gold.
Oh, I'm sorry, I did have one more question that.
I'm sorry,
not
put it in the,
answered. Okay,
put it in the chat, please. I'm
last
sorry,
time.
Rose.
Okay,
Thank
maybe-
you.
okay.
Martha, unmute, please. Martha Gold. Yes,
Okay, I think I'm right.
yes, yes.
So how quickly, if one starts on Medicare Advantage and decides that it's a debacle, can we take our once in a lifetime opt-out situation? How quickly will that go into effect?
The way it works is you would disenroll from Medicare Advantage, from Aetna. And like all these other things, you would arrange to have your, you would fall back in traditional Medicare the first of the following month. That's not a problem. But a supplemental plan may or may not take effect right away. It depends on where you live. It depends on when you do it. You know, as somebody pointed out in another situation that they had a 3-month wait. Those things can happen. So, but traditional Medicare will be there for you when you disenroll from Medicare Advantage. So if you can, you know, if you don't have, I mean, the difficulty is that most people want to do that shift when they're in medical, you know,
need
and difficulty. Yeah. Right. So, you know, that's
so
that's a tough
so
one.
you automatically get back into A and B. It's the supplement that you don't get.
Yes, it's just the 20% coverage for B and the deductible. Yes.
And because I'm a New York State person, pre-existing conditions is not an issue for a supplemental.
Right. It should not be an issue for supplemental.
Okay,
Right.
Great. Thanks so much.
Thank you. Pat Boyle, Eglins.
Hi, quick question. I have to go with Aetna. Don't want to, but have to. Now, I do not have to purchase the pharmacy plan, correct? Do I have to file a form with them or just not sign up for it?
No, you just do nothing.
Okay, great. Thank you very much.
Great. Pamela Carlton.
Okay, so I've listened to all of these things. Now I want a real quick yes or no from somebody. And that is, should you take the Aetna and take the risk, or should you opt out of Aetna and pay money and not take the risk? I mean, that's what it sounds like to me. Is that accurate?
Is that your choice? Is that what you're?
Yeah, is that the choice? I mean, I'm not sure what the choice is at this point.
The choice is to go into Aetna, Medicare Advantage, or to waive city coverage, stay with traditional Medicare and buy a Medigap plan and lose your Medicare Part B and IRMA reimbursements. That's the choice. Nobody can pay me enough to tell you what to do. That's not my job, right? However, particularly if you live in New York State, as Martha earlier pointed out, because the switching back to traditional Medicare and getting a Medigap plan is easier, and you are relatively healthy and sort of just see providers, for regular maintenance healthcare, and you can figure out if most of those providers are actually in the Aetna network, it may be worthwhile to try the Medicare Advantage plan. If you are coming out of senior care, if you have never been in a Medicare Advantage plan before, there is a 12-month trial period. The trick is that most of the other city plans, other than senior care, are in fact Medicare Advantage plans. So there is this 12-month trial period whereby you can, if you're not satisfied, change your arrangement. The details of this are in the FAQs on the retiree webpage. But I think that and this is just me speaking personally, I'm not going to tell you what to do because I don't know what your health situation is. I don't know where you live. I don't know what your needs are. But I think one should seriously consider trying the Aetna MA plan because of the cost factor. If you have a lot of money and you really want to stick with things the way they are, great. But
Okay. Thank you. Vivian Gruder.
I'm unmuted now.
Yes.
I contacted Aetna to find out if one of my doctors would be covered. That is, if whether he would accept payment from Aetna or whatever the possibility is. When I called Aetna, the woman I spoke to on the phone didn't have any information about this. It was finally my doctor's secretary who saw the image of the Aetna insurance card in one of the booklets that Aetna sent, who saw that it lists PPO, and with a PPO insignia, that means that the doctor who is enrolled in Medicare will be paid at the Medicare rate by Aetna, which seemed to make the situation all that more at ease. So I hope you can confirm this. And now that we have the possibility of having the welfare fund coverage for prescriptions, eye care, etc., it makes it all the more seem to be at ease to go into the Aetna plan. But please respond to the question about—
What is the question?
The question about whether PPO means that if a doctor is inscribed in Medicare, receives Medicare coverage, that will continue under the Aetna plan.
I don't know the answer to the question the way you phrased it. What Aetna has said, and we have to take this with a grain of salt, is if a doctor or another medical provider accepts Medicare and is not in the network, they can be paid. They can bill Aetna and be paid the Medicare rate. Or if the provider insists that the patient pays, then you can fill out a form with all the necessary information and request reimbursement of the payment at the Medicare rate. I have a feeling, based on my noodling around their website, that this is a lot of paperwork. I think some doctors are unwilling to, based on my own experience, bill Aetna directly. So you have to do it. So that's the best answer I can give you. There's not a yes or no in there. There's a, more paperwork.
What is the alternative?
Can I just jump in for a minute? PPO stands for Paid Participating Organization versus an HMO. So a paid participating provider is one that is a Medicare doctor. He's already a Medicare participating doctor. They may not belong to the Aetna Medicare Advantage plan, but they take Medicare. That's a participating provider. If you go to Medicare Advantage plan, most of them are HMOs. So those are only covered by people who belong in that network. That's the two distinctions.
Thank you. Okay, thank you, Vivian, for raising that. Doris Weisberg, and then Phyllis Rafferty is going to be the last question. Palmer, put your question in the chat, please, because you spoke before. Doris Weisberg, unmute, please.
Thanks
Okay.
to everybody for all this diligent work. And my question is probably everybody knows the answer to except me, so I apologize. If I decide to go with Medicare Aetna Advantage, do I just do nothing?
Yes, you just do nothing. You will be automatically enrolled.
Thank you. And does Aetna Advantage require a Medigap plan?
No.
And thank you. And my third and last question is a slightly political one, which is, do all New York City retirees now fall under this plan? Or do people like those who work in the mayor's office or the Office of Labor Relations or the judiciary Do they have other?
Oh, that's a good question.
Thank you.
Everybody over 65 who's retired from the city of New York and is receiving retirement benefits from the city of New York is covered. You can, interestingly enough, one of the affidavits in the lawsuit that was filed was prepared by a former city commissioner.
I see. So
So
does that mean the mayor, if he lasts this long in some capacity, will get this same Aetna Advantage plan?
Yep.
Okay.
Yeah.
Thank you so much. Thank you very much.
Okay, thank you. Phyllis Rafferty, last question. You have to unmute, Phyllis.
Unmute. Got it.
Yes.
Thank you. My concern is the timing of sending in the waiver form, because we've been told to wait till the last minute if something good happens from this lawsuit. But I have many disabilities and I can't work this electronically. I'd have to go to a place that would fax this for me. And I need at least 3 days notice to advise somebody that they need to help me. So, I mean, if I sent it in now, I'd be at risk, correct?
No, you're not at risk. We're just advising people to wait because the scenario may change. You don't have to wait, Phyllis. Do what you're comfortable doing.
Yeah, I have to get it out of you because I know I have my decision. I want the Medigap plan.
Do it.
And I've been religiously studying them and speaking with the insurers.
You
So it
don't
won't
have to
harm
wait.
me?
No, it will not harm you.
Because it does indicate any city coverage you'd not be eligible for until their opening period again. And I don't want to be stranded with no insurance because I have many physical problems.
you won't be stranded with no insurance.
No.
No, and we'll be here for
You'll
you.
be there for me.
Okay.
Thank you all very, very much.
Okay, well, before we end, I want to ask Diane Mena, our vice chair, to just say a few words about membership, and then I'll close us out. Diane?
Yes, hi. I just wanted to make an appeal for those of us, we invited non-members to this meeting. We opened the meeting up. And if there are some non-members out there, either because you let your membership lapse or because when you retired, you didn't realize and you forgot to join the union back up again, we're asking you to go onto the website and to reapply for membership and join the union. We do a lot of good work, as you can see, not just for Medicare, but other issues. And we have fun too, because if last month, for example, Penny Lewis gave some of the retirees a labor tour of Lower Manhattan, and she's promised to do that again for us and maybe some of the other boroughs as well. So there are lots of other things to do besides just working to keep our Medicare. And so we urge you to go onto the PSC website, psc-cuny.org, and follow the links for membership. It's only $85 for full-timers and $40 a year for part-timers. So please apply for membership if you've let your membership lapse.
Thank you very much, Diane. We'll talk more about membership and what the chapter does and what the chapter has done this year at our September, I think it's September 11th, opening meeting of the next academic year. It'll be the Monday after Labor Day, which I think is the 11th. I want to thank everybody who attended, who has been attending. You've been doing the research and studying and coming out to demonstrations and calling the city council, and all the work that everybody has been doing has brought us to the point where we have been able to really fight this for 2+ years. Given the fact that the situation is still in flux, particularly with the lawsuit, I ask you to hold on your calendars Monday, June 26th at 1 p.m. for a possible meeting, another meeting. I know, we're probably like totally over our heads with meetings, but if we need one, we will call it. If we need it before then, we will call it. We will communicate to you with our blast, as we always do. You can write to us and ask questions, but please go to the website, read, reread, and study the material that is on the website. A lot of work has gone into that. And if you can answer questions by going to that information, that really makes us more efficient, and you don't have to keep asking questions. I mean, you should still ask us questions if you have questions. And there may be questions about the answers to the questions on the website. But good to see you all. Maybe one day in person, somebody asked about, but not on June 26th. So best of luck as you travel this very nerve-wracking road to make a decision. And we'll see you all soon. Thank you.